I'm Dr. Robins, and been here in Spokane for about 25 years. Started the first program for reproductive endocrinology and in vitro fertilization here in '98. So when I was in fellowship, actually a little before fellowship, I was married to, I married a medical student a year ahead of me. Right at the end of residency, we were ready to have kids, and we didn't. And then we decided, well, we should probably, get some infertility help. And just as we made the appointment, as it often happens, we did get pregnant and had our first child, and then we struggled and unfortunately had a miscarriage that was very depressing. And so after that, we started treatments there at Bethesda Naval, and my mentor in New Jersey said, "Why don't you just do IVF?" And so we did. And when she was pregnant, and I'm going, there's one, there's two. There was actually 3 sacs, and one of the sacs stopped growing, but the other 2 did super well, and no C-section. Everything went great, and they're doing great now. Still do things that push the practice forward and the technology forward, and that accompanied, I think, really with the fantastic nurses that we've had here and our ability to have a very close association with our patients. You call here and you get somebody to talk to. It's not call in and hope maybe you get referred to Seattle, some other place. Here, it's all done here, and we've always had a complete Spokane presence. I think that infertility is a very serious problem, and a lot of people take it for granted who've never really faced it. And people have done different kinds of measurements that have shown that the amount of stress and the amount of depression that is experienced by infertility patients are really very similar to cancer patients, and that puts that into perspective, or very serious cardiology and heart attack type patients. So it's a very serious situation, and it's something that it's important to see people who know what they're doing and going to take good care of you and get your best chances. It's not the universal cure for every patient who has infertility, and so grief counseling and other things are important. But really trying the most that you can is really an important thing. And I think that it also drives me to deliver the very best chances possible. I'm always reminded of my kid's mom, my twins' mom, when she was asked, is IVF hard? And she goes, not when you get pregnant the first time. So that's my goal, is for every patient to get pregnant the first time. Certainly the technology which moves forward and moves quickly is challenging and exciting. But it's also rewarding, building families, building relationships with patients who are worried they may never have a family. And you just wouldn't believe the cards that I get. I'm now getting cards from people graduating from college, and it's so amazing to hear from people that still talk about what a great experience it was. It's one of their Thanksgiving meal themes is, what do we have to be thankful for that we have these children that we never knew we were going to have. And so it's extraordinarily rewarding. And the biggest reward of all is generally patients really expressing what it means to them.